By the time I have finished this presentation, 55 people will have died of sepsis, a life-threatening condition that occurs when the body's response to an infection damages its own tissues and organs. Worldwide, sepsis affects 30 million people annually. 9 million do not survive. Sepsis kills more people than cardiovascular disease or cancer. It does not discriminate. You can see Maddie, a young student who died of sepsis. And some survivors suffer lifelong consequences, like Mac, who had post-traumatic stress disorder. Effective treatment of sepsis depends on early recognition, and this is challenging because initial signs can be subtle and non-specific. Most of what we know about sepsis comes from research conducted in developed countries. We know sepsis is becoming common in hospitalized patients. Limited evidence suggests that sepsis is more prevalent in poor and lower income countries, where the mortality rate is also higher. So, how to address this issue? In my PhD, I tested a new tool to screen for sepsis in 5 hospital wards in Argentina, a developing country. The tool uses 3 clinical signs: high respiratory rate, low blood pressure, and altered mental status to assess in patients with known or suspected infection. Working with 150 clinicians, we evaluated the tool in over 1,000 patients. Nurses were responsible for patient screening and reporting when they thought the patient had signs of sepsis. Then physicians reviewed the patients and provided treatment. This process was integrated into usual practice with no additional clinical resources. What I found is that the tool could help us differentiate those patients who did not develop sepsis. It was not as good in helping us to predict which patients would develop sepsis. Nevertheless, nurses' assessment skills and physicians' response did improve. More importantly, we learned that sustainable change is possible where all health professionals work together in a creative manner. When I was collecting data, the Global Sepsis Alliance has expressed interest in my study. Conducting this research in a developing setting broadens our knowledge about a different way to improve sepsis care. So, where to from here? I will share my experience at a global level so I can help to save more lives from sepsis. Thank you.